Hello, everyone, and welcome to the second episode of Doses of History, the painful art of amputation. I'm James.
I'm Karen.
And I'm Honey.
And before we start, we'd like to just talk a little bit about the podcast and how far we've come and, how it's kind of played out. Now, for those of you who have seen episode 1, you would see that it's a little bit different in quality. Now, it was before we received the money, but it was after we were approved. There was a little bit of time between those 2 points where we needed to get recording, and because of that, we recorded it in over quite a large space of time, and we were in different spaces, different environments, and we spliced it together as best we could. As you can see, the quality has dramatically increased, and we got new mics, new cameras, and new equipment, and it's gone up significantly. And of course, the headphones, which makes us look like proper professionals. Mind, we look good. Now, it has been a long journey. It has been a very steep learning curve, which is a good thing because we originally started purely out of wanting to share our love for history and being trustees of Bath Medical Museum. We wanted to take the ethos of that museum and put it into a podcast. We have figured that the production is kind of fluid. Would you say, guys, fluid?
Mm-hmm.
Yeah,
I'm gonna
would you say
sneeze.
that?
I'm so sorry.
That's all right.
Organic, yes. We
Mhm.
wanted to.
Sorry,
Cheers.
let's try to hold it.
It is organic, yeah. The first episode was very much scripted, and we put the content and what we were saying way above the actual feel of the episode. And so we read a lot, we got a lot of notes, and we were determined to get as much information in as possible while trying to make it as interesting as possible. It kind of worked and it kind of didn't in some places. And of course, you see a random picture of Honey's face while someone else is talking. And unfortunately, that's because we use Zoom to film these for two main reasons. Number one, it's free. And number two, everyone, or mostly everyone, has access to Zoom and knows how to use it. So when we get guest speakers on, they always have Zoom, whether they're academics or otherwise. So it's just really easy to use this and to film it and edit it. So that's why we use Zoom. And the quality, I guess it's as good as it can be on Zoom, and I think for our purposes, it's as good as it needs to be.
Well, the idea came about just to make the museum a little bit more fun in a way, and to bring the museum out into the world. And it's interesting how a new project begins, especially when we don't have the experience or the background on podcasting and things like that. So I really want to acknowledge us all, how we are improving in every episode, and the good part is that we are enjoying ourselves. Of course, we had our challenges at certain times, but overall, I think we are really enjoying the process. And with all together, we have a background in history, psychology, business, heritage management. So we have a lot of knowledge, information, and this is a new skill we're learning and a new way to take that information out into the world. So way to go, guys.
Yeah, I think
We're
it's
doing
very
good.
new for us. Yeah, it's important that you said that we don't have any professional podcasting experience. So this is just us talking about what we're interested in, and hopefully other people will be. Yeah, we'll see how it goes.
I think that's a really good point as well. This is to reach new audiences. So this really came about because the museum faced some challenges last year. We were originally meant our original model of operating was to open every Saturday. Unfortunately, that just wasn't sustainable, and so we had to come up with another way of operating. So we thought rather than expect visitors to come to us all the time and walk through that door, we come to them in a new way and share the history and lots of stories that Bath Medical Museum has, but just hasn't got the capacity to tell them in the physical way. So and here we are, and we love it, don't we? We love it.
Yay!
Woo! So, without further ado, now that you've got some background and our motivations and the fact that we really, really like doing this, let's get on to chapter 1. Now, the theme of this episode revolves around an object in our own collection, a 19th century amputation knife. It's very sharp and very shiny. So come with us and imagine walking into a hospital operating theatre in the early 1800s. But remember, there's no anaesthetic and no antiseptic. Patients are fully conscious. The room you're walking in is crowded with surgeons, assistants, and rows of medical students craning their necks from the galleries to gaze upon the surgical gore that's going to be ensuing below. The noise is loud and the senses are overwhelmed. The patient already knows surgery, especially amputations, could be deadly. But what other choice did they have? However, the first thing you notice isn't what you see, it's what you hear.
The operating theater was loud, not with machines, but with human voices and suffering. Charles Darwin witnessed surgery as a student at the University of Edinburgh in the 1820s. He later wrote, "I witnessed 2 very bad operations. The screams of the patients rent the air." Darwin was so disturbed that he abandoned his plans to become a doctor.
One of the most famous and in-depth first-person descriptions of operations without anaesthesia comes from novelist Fanny Burney. In 1811, she endured a mastectomy surgery at the age of 58 without anaesthetic. This lasted over 3 hours. However, the term mastectomy was not actually used during this time, and instead it was referred to as breast surgery. Her description was written in a 12-page letter to her sister in 1811. It details her experience, offering a horrifying glimpse into early 19th century medicine. The quotes from this letter include, "I began a scream that lasted uninterruptedly during the whole time of the incision. When the dreadful steel was plunged into the breast, I needed no injunctions not to restrain my cries. I felt the knife rack against the breastbone, scraping it." However, despite all of this, she felt proud, stating, "However, I bore it with all the courage I could exert. I never moved, nor stopped them, nor resisted, nor remonstrated, nor spoke." From this, we see her courage and unyielding bravery is a testament to all those who endured operations without anaesthesia. Despite having to endure this horrific operation, Fanny lived for another 29 years and finally passed at the age of 87 years old in 1840. Although this was not technically an amputation, we felt it was important to share Fanny's story and also to highlight what surgery was actually like from a first-hand perspective without anaesthetic.
The screams weren't the only sound, however. Students remembered hearing surgeons shouting instructions, as you would expect, the sounds of assistants struggling to hold patients down, and the unmistakable sound of that bone saw. In amputations, surgeons often try to finish in under a minute to limit the suffering. The famous Scottish surgeon Robert Liston was known for his ferocious speed, and it was both a gift and a curse, when during one operation he accidentally sliced off a patient's testicle along with the leg he was amputating. A student commenting on Robert Liston's speed quoted, "The gleam of his knife was followed so instantaneously by the sound of sawing as to make the two seem simultaneous." At 6'2", he was 8 inches taller than the average British male and had made a reputation on brute force. His left arm was so strong that he could use it as a tourniquet while still wielding a knife in his right hand.
Now imagine the smell. Sound was not the only overwhelming sensation. Hospitals in the 19th century smelled terrible. Before antiseptic medicine, surgical wards were filled with infected wounds. Joseph Lister later recalled conditions at Glasgow Royal Infirmary, and we're going to quote him. The wards were often filled with the odor of suppuration. We will find out more about Joseph Lister on Chapter 2.
In the quote from Joseph Lister that Karen just described, where he says suppuration, he's meaning pus. This is because infected wounds produced a thick discharge and rotting tissue. Lister continues to describe the hospital air as loaded with the effluvia of putrefaction. In other words, he means the smell of decay.
So really, if you happen to be a spectator in an operating theatre around 1825, or generally any time before then, you would experience the screams echoing around the room, the scrape of the bone saw, surgeons frantically racing to finish the operation, the clanks of surgical instruments, and of course, the unmistakable metallic smell of blood, the smell of infection, and the smell of unwashed bodies.
So you can imagine how dreadful this situation was. This was brutal reality, so vividly documented, which explains why the discovery of anesthesia in 1846 was revolutionary. For the first time in history, the worst pain that was for so long a companion of surgery was finally no more.
The first successful public demonstration of modern general anesthesia was ether and administered by William T.G. Morton on October 16, 1846 at Massachusetts General Hospital in what is known today as the Ether Dome. Surgeons in America and Europe quickly adopted the method and developed their own instruments to deliver the ether to the patient. Some relied on the simple method of holding a cloth with a few drops of ether onto the patient's mouth. Then the ether mask would be used to secure the cloth in place on the patient's mouth. Notice the troughs on the sides of the ether mask. These were to catch the excess anesthetic to prevent it irritating the patient's face. Others, on the other hand, developed inhalers as a way of delivering the ether or chloroform. The 21st of December 1846 saw the first time ether was used in England as a general anaesthetic and was administered by William Squire during a surgery by Robert Liston. The operation was an amputation through the thigh of Frederick Churchill's leg. Chloroform was developed very shortly after ether in 1847 and introduced by Scottish doctor James Young Simpson. Chloroform then became the popular anaesthetic for childbirth.
But what about all the infections people would get after surgery? Well, fast forward to the 1860s to a man we've mentioned, Joseph Lister. He's about to change surgery forever. So join us for Chapter 2 as we explore the beginnings of modern-day medicine.
Hello everyone, and welcome to Chapter 2. So now that we've built that brutal image of screaming patients and surgeons with more blood on them in the patients themselves, the question now is, how did surgery really change and become the foundation of modern day medicine? Because even after the medical marvel that was anesthesia, amputation remained incredibly dangerous. The biggest threat was, and still is, post-operative infection.
Hospitals at this time were very, very dangerous places to be. Most patients were having serious complications, not only because of their illnesses, but conditions like gangrene, erysipelas, and hospital gangrene and sepsis were in constant threat.
In addition to this, surgeons didn't yet understand bacteria. Many still believed infections were caused by bad air, or miasma as it was called.
Surgical instruments were rarely cleaned. Knives may get a dip in some cold water and a bit of a shake about, but that's about it. Surgeons operated in blood-stained coats, which they wore as badges of honor of previous operations.
Sponges were reused over and over again, from one patient to the next. And hands were not washed that often between operations. So what really was happening, there was lots of cross-contamination everywhere.
Because of this cross-contamination, many amputations were successful operations followed by fatal infections.
Mortality rates after major amputations in mid-19th century hospitals could reach 40 to 60%, which meant if you needed a leg or an arm chopped off, you would put it off as long as possible until there was simply no other option.
The next breakthrough comes in the 1860s with surgeon Joseph Lister. He was inspired by Louis Pasteur's work, which showed that tiny microorganisms were behind things like decay and fermentation.
Lister begins to wonder, what if infections after surgery are caused by germs entering wounds?
His solution is simple yet radical. Kill the germs before they have the chance to infect the patient.
Lister starts using carbolic acid, also known as phenol, as an antiseptic. He applies it to wounds, instruments, bandages, and even sprays it into the air in the operating theater.
The results are dramatic. In Lister's early amputation cases in the 1860s, infection rates fall from approximately 46% to 15%.
One famous example is when Lister trialed carbolic acid during an operation on a young boy who had been run over by a cart. He fractured his leg and it left the bone sticking out through his skin. Traditionally, accident like this would be treated by amputation above the fracture. Instead, Lister set the bones and used dressings soaked in that carbolic acid. He left the dressings on for 4 days until the boy began to complain of irritation. Lister thought the pain the boy was experiencing would be because of infection, but instead, once he removed the dressings, there was no sign of infection. The pain and irritation had been caused by too much carbolic acid and was causing negative side effects, one of the reasons many criticized its usage. Nevertheless, Lister continually treated the wound with carbolic acid dressings and the limb healed without any sign of infection. After this, Lister's famous aerosol spray of carbolic acid was used throughout surgical theatres.
But, like many big medical breakthroughs, this didn't convince everyone straight away. Reports published in The Lancet between 1868 and 1869 showed very mixed reactions from surgeons. Some were really enthusiastic, others abandoned the method, saying it didn't work, or that it was just too complicated. And some prefer simpler alternatives, like different antiseptic dressings.
This controversy among surgeons can be explained in 2 points. First, there were other theories surrounding wound infection and sepsis. And second, there was question of whether other antiseptics or fresh air, hospital hygiene, or just simple cleanliness during operations were just as effective as Lister's complicated regimen. Despite this being controversial, soon surgeons did begin to combine anaesthesia, antiseptic techniques, and better surgical methods. Together, these transformed amputation into a much safer surgical procedure.
So by the late 19th century, an amputation would look very different from earlier centuries.
By this point, the whole experience of surgery had changed. The patient would first be given anesthesia, usually chloroform or ether. A few drops would be placed on a cloth, held over the patient's face, sometimes with a small mask to keep it in place. Within minutes, the patient would lose consciousness.
In the meantime, the surgical team would prepare the area. They would wash their hands, clean their instruments, and they would apply antiseptic solutions.
Surgeons would carefully design the skin flaps used to cover the stump. This helped the patient later use prosthetic limbs.
They also started tying off blood vessels using ligatures, basically surgical threads, rather than relying only on cauterization to stop bleeding.
The bone would still be cut with a large surgical saw. However, the operation was no longer a frantic race.
Well, that's good, isn't it?
Yeah.
Well, the 1 minute
It's very
surgeries were over.
It's brilliant analysis. Wow.
Surgeons, but surgeons could now take the time to smooth the bone, shape the muscle around it, and close the wound carefully. Surgeons were no longer against the clock of a screaming patient.
Once the operation was completed, the wound would be dressed with antiseptic bandages, soaked in carbolic acid, then carefully wrapped in layers of gauze.
Amputations remained extremely common through the end of the 19th century and into the 20th century. This is because of industrialization and warfare. In fact, one of the amputation knives we have in our collection was used to amputate a man's leg down a coal mine in Somerset.
Brutal. Conflicts like the American Civil War and the Great War, thousands of soldiers required amputations.
As you mentioned, James, amputations were still common, but survival rates were improving. And that's really thanks to the combination of anesthesia and antiseptic surgery working together.
In just a few decades, surgery went from something terrifying and brutal to something approaching modern medicine.
Anesthesia removed the agony.
And antiseptic surgery tackled the biggest hidden danger, infection.
Together, anesthesia and antiseptic turn amputation from something of a desperate gamble into a controlled medical procedure. If visitors come to our exhibition, you'll not only see some objects that we've described in this episode, but you will also be able to smell what remains of the famous carbolic acid. It's still available to buy today, so we have a pink bar of antiseptic history. However, it no longer contains phenol due to health and safety regulations. But it does give a glimpse into what surgeons and patients alike may have smelt during these early operations.
So now that we've given a brief but hopefully very vivid history of what amputation surgery was like before and after the discovery of anesthesia and antisepsis, we're now going to jump forward all the way to modern day and talk with a wonderful, if slightly unhinged man. He's a barrel of laughs, but really, I love you, Rob. His name is Rob Franks. He's an above-the-knee amputee, and he's going to be talking with myself and Karen and share his own story of pain, overcoming obstacles, and ultimately how one injury changed his life forever. So first of all, welcome. Having you on is amazing because, you know, you're living and most of the people we talk about are dead, so that's nice.
Yeah, I've got one up on them.
Just slightly.
For now, anyway.
First of all, massive shout out to Rach for getting me in touch with you. I explained what we would do in this episode on, and she was like, I know exactly who you need. First of all, introduce yourself.
My name's Rob Franks. I'm 47. I live in Poole in Dorset, and I'm an above-knee amputee.
Awesome. Welcome. How did you become an amputee? Where did it all start?
Okay. Right, the story's quite a long one, so I'll condense it.
That's fine.
So I was playing cricket back in 2011, and I incidentally slid for a ball. Nothing more than that, and I felt my knee twinge. So after a lot of, I carried on playing, and then after a lot of hooing and hawing, my wife made me go to the doctors, who sent me to the hospital for a scan and an X-ray, and I thought nothing else of it. About 5 hours later, I get a phone call. Can I go into the doctors? And I was like, yeah, no worries. That's quite quick. Normally it's 7 days. Anyway, so I walked in quite happily, and he goes, can you sit down? And I was like, yeah, if you want. I said, is my knee that bad? He goes, well, you have torn your meniscus, but we've also found a shadow on your femur, and we think it's sarcoma, which is what it turned out to be.
Can you explain for those who don't know what a sarcoma means?
So sarcoma is a bone cancer. It starts in the middle of in the root of your bone, so into your right deep into your bones. So it's like a bone cancer, and it is a bone cancer, and it was really weird. I was like, wow, okay, what do we do? And he said, well, I'm going to send you up to Stanmore, which is in London, in Watford. And he goes, we're going to get a specialist to look at it and see what the next steps are. So that's what we did. But that's not where the amputation started.
No?
Yeah. That was, when I was doing some research on you, that was quite an interesting story, because
yes, it's quite quite in depth.
Yeah, it's not an ordinary story, but it's
No,
extraordinary outcome.
yeah, I mean, it's bizarre. So basically, I had the cancer taken away, had some treatment, fine. A year later, it comes back. I was like, typical, my luck. Had that taken away. But as they were operating, they hollow the bone out, and then they fill it with like a filler. So where the tumor was will grow around it and go strong, become strong again. So they did that, although they didn't. I didn't know this. So it was about 6 months after having my second tumor operation, my second sarcoma operation, that they said I was in a full leg brace because I literally couldn't move my leg. I couldn't weight bear or anything properly on it. And I didn't know why at the time. So they said, I spoke to them and I said, look, I'd like to go back to trying to play a little bit of cricket because cricket's my big passion. And would that be okay? They said, yeah, that'd be okay as long as you're steady. So I was in this full leg brace. I looked like Robocop at the time. And my second game, I ended up playing a little bit of county cricket, disability county cricket for Dorset. And in my second game, I played a shot just off my hip. As I played the shot off my hip, my leg snapped in half right away through my femur. So your femur is the biggest bone in the top of your leg. Yeah, it was hideous, to be honest. It was absolutely hideous. I can still remember the pain. I can remember what it sounded like. So it's like you're in the woods and you stand on a twig and you hear a twig crack. That's exactly what it sounded like. And I knew straight away something was seriously wrong. Ambulance was called. Took about 45 minutes to get to me. I was led on a cricket pitch looking like a right clown, screaming because of the pain. My son was, what was he then? 18 months old, I suppose. And he heard and saw everything, which is really now still cuts me up because I was in a lot of pain, and him witnessing his dad like that obviously affected him quite a lot. Anyway, I digress. So I had, they came, the ambulance people, and they gave me ketamine, and I don't remember much after that because ketamine's obviously quite a strong painkiller, and I can't have morphine because morphine makes my heart stop. So they had to try and find another method to knock me out, basically. So we had that done, and they rebuilt the leg. They rebuilt the leg with pins, plates, rods. So basically the whole of my thigh was being held together. Fast forward, I don't know, say 3 years, and the pain just wouldn't go away. And it turns out the fracture never healed, and it wasn't likely to heal. So I was on 28 different painkillers every day. I was in bed all the time. I just couldn't do anything. I couldn't function. And I took the decision, spoke to my lovely wife who supported me wholeheartedly on this. And it's something not many people would have done. But I went up to her one day and said, I just want to have my leg chopped off. I'm done with this. I can't do it anymore. She looked at me, probably thought I was a bit mad. She goes, you know what? Let's do it. So we researched. I spoke to the NHS, who refused my amputation because they said it wasn't a necessity. I explained that it was a necessity because my life has changed to a point where I couldn't do anything. And they disagreed. And I said to them, one way or another, I'm going to be having my leg chopped off. And they looked at me, the surgeon looked at me and went, good luck, because it's not ever going to happen. So I took that as a bit of a personal slight, got a little bit annoyed, got a little bit angry and a bit upset, got home, and I researched for about a week, found a surgeon, private surgeon, got an appointment with him, spoke to him. He couldn't understand why the NHS wouldn't do it, and he was happy to do it. So, yeah, he agreed for my amputation. So then I started crowdfunding. So I crowdfunded just over £15,000 to have my own leg chopped off. It's a story.
Wow.
It is quite a story. And I really want to acknowledge you because what I see is someone who's taking the power within to make his own choices, regardless of whatever people were saying outside. But the level of strength and wisdom it took for you to say, I need to do this.
I wasn't living. I wasn't a dad to my kids. I wasn't a husband to my wife. I just couldn't carry on like it. And if I hadn't taken that decision, I'd still be like it now. And that's 10 years, 12 years down the line. I had it done 21st of March 2018. So it's my ampuversary on Saturday.
Wow. We're getting close there.
Yeah, it's always quite a poignant day because that was the day my life changed. And I always reflect quite a lot on that day. Yeah, it's weird. It's quite weird to think how, when you look back at it, how much you actually have been through and come out the other side. It's really strange.
That's quite interesting because I know for a lot of people, amputation is like it's just like the last thing you want to do.
Yeah.
But for your case, it was the only option that
Oh,
you
100%.
you
Yeah,
had
there
to
was
do.
no other option. The
Wow.
options were I carry on like I was and not get any, not have a life and not be a father to my children or a husband to my wife, or we have this done and hope it works.
You get the leg removed by this private surgeon, and
Yeah.
I was going to ask how did that change your life, but evidently it's had a positive
Yeah.
effect, I expect.
Yeah.
And can you kind of tell us how your life is positively changed by this then?
I mean, it's just changed dramatically. I'm like a normal person again. I mean, I still suffer with some PTSD after everything that's happened, and my mental health has suffered from it, and there's no denying that. But I'm out the other side, and I now support other amputees who may be going through a tricky time, and I want them to look at me and go, "Well, if he can do it, so can I." That's my main goal. I just want to help as many people as I can to come to terms with a life-changing illness, disability, whatever you like to call it, because it doesn't have to be life-changing, or not in a negative way. It can be life-changing in a positive way, and that's the biggest thing. I've always said, if you keep your mind positive, you'll be fine. It's like a process, and I swear by it. If you've got a positive mind, you'll be absolutely fine.
That's beautiful, man.
And do you think your identity has changed, from before that?
No, I'm back to the old me. I'm back to how I was 20 years ago, which is weird. My wife always used to call me Tigger because I was bouncing around. And then, yeah, I know, tell me about it. And then obviously everything that happened, and I just went so far into myself, it was unbelievable. I was unrecognizable. And now I'm back to how I was. Weird.
So you lose your leg. What did life what was it like not having the leg? Like you things change, you got you have I'm assuming you have prosthetics.
Yeah.
What was that, a learning curve to live without the
No,
leg?
I woke up from the operation. I say woke up. I came around from the operation. I was in horrendous pain. I mean, it was just like something I've never experienced. And I was like, what have I done? That was my first thought. Then I was like, no. That was about 5 seconds of what have I done? And then I was like, no, come on, sort yourself out. It was weird because when I went to have the operation, the surgeon, as he said, would I like to walk down for the last time? So I walked down to the operating theatre. But a lot of people, when they have elective amputations, they like to have a bit of a goodbye leg. I was bloody delighted. Sorry, excuse the swear, but I was bloody delighted. I was like, off you go. And when I had it done, the surgeon came in and I go, where's the leg gone? He goes, you see that lorry over there? I went, yeah. He goes, it's in there. Yeah.
Wow.
Mad.
I mean that's got to be surreal, hasn't it? Like
yeah, I mean, it was then that what really hit me was the day before having the amputation. I was getting everything ready and I only had one shoe in my bag, and that hit me because it was like, wow, I don't need two at the moment.
it's like symbolic, isn't it, having just one shoe?
It was I actually did a video diary for BBC, and they tracked it all, and it should be online somewhere.
And talking about the shoes, when you go and buy shoes nowadays, they're able to sell you one shoe, or you have to buy both.
There is a site on Facebook called Joe's Odd Shoes, and they get shoes donated to them from like very well-known companies, and then they send them out to you if you need them. I actually got friendly with a bloke who had his done the day after mine, not in the same place, but we met online on a Facebook amputee group, and we were both size 10s. So he was a right leg amputee, I was a left leg. So for the first 2 months, we swapped shoes. We bought a pair of shoes together. We'd like go halves. I'd send him one and I'd have the other. Weird.
Oh, that's brilliant. That is amazing.
It's
Sorry.
amazing. You're quite an example of having a very strong and positive mindset
I
because
think you've
it's,
got to. I think in life's hard enough
yes.
without the added stress of everything else. And I think you've just got to be as positive as you can be. And
Absolutely.
I mean, I came out on the 20th, so I was 2 days in hospital.
Only 2
21st
days.
Yeah.
Wow.
21st, I wanted to go and do something. I was fed up because I was bored. And 2 days in, bearing in mind, I was bored. So we went to Portsmouth and we went to the Royal Naval Museum because my
Lovely.
little boy loved like boats and all that. When we were there was a climbing wall. And I said to my wife, just for a joke, bearing in mind I was in a wheelchair at this time, I said, what do you reckon? Should I have a go at it? Woman behind me turned around. She goes, "You've got no hope." So I took that as a red rag to a bull. I went to see the bloke. I hopped over to the bloke. I went, "Do you mind if I have a go?" "Yeah, carry on," he said. I strapped myself in, got all the way to the top, abseiled down.
Wow.
I turned around to the woman. I winked at her and blew her a kiss whilst about 150 people were clapping me.
Well done, Rob.
Yes.
I'm one of these that don't say I can't do anything because I can, and I will.
Yeah. And what happened did you ever go back to your GP or changes have been made in NHS as to listen to their patients more or something or no?
I wanted to go back to the surgeon and say, "Look, I told you I'd get this done." But unfortunately, he moved away, so I couldn't. But I would have done if I could. But my doctor obviously knows my situation, and there are orthopedic surgeons that also know what happened. So yeah, I think quietly I'm quietly smug because I proved to him that it had to be done.
But more than proving to him is the NHS has changed their attitude as to listen more to patients and what
They
they're
have.
really feeling.
They have.
Yes.
I mean, in a way, I understand why they wouldn't do it because my leg wasn't hanging off. It wasn't anything like that. It was pain that they couldn't see. So I do get it. But I do hope now that since that's happened, that they are more open to what a patient wants. And I believe they are from what I'm hearing from other amputees.
Mm-hmm.
I mean, yeah, only the patient knows what they want. That's the biggest thing. Doctors can train for years, but I never feel what a patient's feeling. I mean, I had to go through a psychological assessment before my amputation because they wanted to make sure I was of sound mind, which I passed, weirdly, much to the dismay of many people, considering I was going to have my leg chopped off. And I passed with flying colours. And they just didn't want me to regret that. They wanted to make sure I wasn't going to regret it.
Of course. Mm-hmm.
I completely understand.
Because I could have sued them and said, "Look, you didn't do all you should have done." Obviously, I'd never do that.
Well, the good thing is that you're happy now and you're enjoying your life.
You are happy.
That's what counts.
And the prosthetics now are just unbelievable. They really are unbelievable. I mean, I'm trialing some legs at the moment because I've done 6 years on my last leg. It was called an Otterbox C leg 4, which is an amazing leg. But I wanted to try something that I could potentially run on. So I'm trialing some legs at the moment, which sounds weird, like on leg shopping.
I mean, technically you are, so.
Well, why not? Why not? And yeah, I'm trying some legs now. So the prosthetic side of things is just going to get better and better. So I'm trialing at the moment a Ossa Navi. It's called Ossa Navi knee. And to be honest, I'm not keen. It just doesn't feel right on me. So I'm going to be trying another one, which is a Freedom Quattro knee in the next few weeks. And then I'll make a decision whether I have the newer version of my old leg or I go for one of these two new ones.
That was actually going
to be. They're all electronic. I have to plug them in.
Oh, wow.
Okay. In what, as in like they're power assisted, or they got like gadgets on them? What
to do with gait, how you walk? It learns. It's got this leg I've got at the moment, the Navi knee. It's got AI in it, which is weird. So it learns how you walk and helps you to keep a steady gait. It's over my head, to be honest.
Wow.
I never knew.
The NHS, to be honest, have been amazing. The prosthetics have been amazing. Prosthetic Centre in Bournemouth have been amazing. And, they've changed my life. But I mean, it was really strange because I got cast for my first socket at 6 weeks after my amputation, and they gave me a practice leg. And he goes, right, we're going to give you a proper leg. And I was like, okay, brilliant. So I had to wait a few weeks. That came. I got the leg, and he goes, right, it's going to take 6 months to walk in this confidently. It took me 2 hours, and I was off running. Not running, but I was off and walking.
Do you know what? You are a testament to like to that.
Stupidity.
Well, stupid. I mean, we could all be like guilty of that, but you're just a testament to like, watch me go. Just watch me go. You know, like, tell me I can't do it, but you come back in an hour and I will.
That's the thing. I won't give up until
Like,
I've got
amazing.
things done that I want to get done. My wife's been my rock, to be honest. Without her, I don't think I could have done this. That's me being perfectly honest. Without my family's support, I don't think I could have done what we've done.
Do you think that's half the battle? Is the support system behind
Massively,
you? Yeah,
massively. I mean, when I was at my lowest, my wife and my children were there to bring me back up. If they weren't, who knows?
Wow, it just goes to show,
Story
doesn't it?
probably was different.
Yeah.
Oh my
But
god!
if anybody does want to read about anything, I do have a book.
Oh,
yes.
From disability to ability. Wow. Yes.
It's called From Disability to Ability, My Journey, and it's got everything in it. And I wrote it specifically for anyone going through a tough time and to help them. And I've documented it. It took me 6 years to write because I just did bit by bit. But yeah, so if anybody does want that, all money for it goes to charity as well. So.
That's brilliant. So let's just briefly go back. Let's go, because I know a lot of people have general knowledge of kind of, well, I'm sure you've heard of it, phantom pain.
Yeah.
Have you post operation physical pain, phantom pain? What's your experience of that?
And I get a lot of phantom pain.
What does that feel like? What is it?
It does reduce me to tears because it hurts that much. It's mainly at night, and it's when it's really weird. It's when the weather's changing. The weather's going quite hot or quite cold. It always affects it. Atmosphere affects it massively, and it's really weird. It's like somebody's got cheese wire, and they're putting it through my toes. Yeah, it's really strange. And then there's others that are like a burning, stabbing sensation. So I had it really badly for about the first 6 months after my amputation. And I went and my wife looked up some ways of combating it. And we went through mirror therapy. Just put a mirror in between your legs. Your brain thinks that you've still got 2 legs. And it worked a treat. But I do get phantom pain, and it does explain that to somebody. They're like, but you haven't got a leg. How can it possibly hurt? But I've still got the nerve endings.
Yes.
That's what it hurts. It's really strange, really strange. I teach in a secondary school, and a lot of the kids are always asking me about phantom pain and how you combat it. You just have to hope it goes away quite quickly because it can last anything from 30 seconds to 5 hours.
And this isn't the type of pain that can go with painkillers, is it?
No, there's nothing that can be done. I'd say probably 99.9% of amputees go through it. But it's part and parcel of the journey, you know. It makes you more resilient because you've got through that little period of negativity, if you like.
Did you have to go through any type of rehabilitation? Did you have to learn to do certain things? What?
I had a little bit of physio.
Yeah.
But I worked at home on my own. I just found it easier because the physios were great, but it wasn't quick. It wasn't quick enough for my liking. I was seeing him probably once or twice a week. And I was like, just give me some exercises at home and I'll do it. And then I'll see you once a week and we'll see what progress we've got. And that's what we did. And it worked really well. I mean, I tried to run before I could walk, basically, but it worked. I wouldn't advise it for everyone. I have had a few little incidents. I've fallen down stairs. I was hopping down the stairs, got a bit overconfident. It was 6 months after my amp. Just got up, about to get ready to go to work. Started hopping down the stairs on one leg, oh, look at me. And then my dog was on the step noticed her, tried to miss her, completely lost my footing, went down about 15 stairs, cracked my head on the wall, broke my nose.
Ouch.
Rob, what are you doing, boy? Honestly,
Well, I haven't got time to mess around, you know.
get the leg off and get me down those stairs. Let's go.
Yeah, come on, crack on.
This has been a huge positive change for you. And
Yeah.
and you're definitely not the only one in this position. There are people out there that have got
Yeah.
that maybe don't meet the criteria for an amputation, but really need it.
Yeah, I mean, I've got a Facebook page which I was very active on and haven't been of late, but it's called Got Rob Legless. It was Get Rob Legless, and it's now Got Rob Legless. And it was about a year because I went on to the Jeremy Vine show a few times because he was the one that pushed my fundraising to get my leg amputated. It was his show that pushed it, so I ended up going on there a few times. And I had somebody come up to me and they said on the Facebook page saying, "How can I? Oh, I'm in the same position. How can I broach this? How can I find a surgeon?" And they found a surgeon. I gave them some tips. I found a surgeon. They found a surgeon. They spoke to the surgeon. They're now legless. Brilliant. They're now in no pain.
I applaud your journey, and I applaud the fact that you've been able to write a book on it as well.
Thank you. I mean, the book was literally, I was jotting down things as it happened. And I thought, you know what, let's write a book. Why not?
And I guess as you're writing it as well, you're constantly reliving the memories.
Yeah. Oh, yeah. I mean, it was quite hard at times because you don't realize what you've been through until you reflect. Yeah. And having like my notes and writing things down, I could reflect quite a lot. And it's only now you look back and you go, geez, how have you gone through all that? How have you come out the other side? How are you still here? But I'm a firm believer that somebody somewhere, I mean, I'm not religious, but somebody somewhere was looking over me because I can't, they said if they hadn't caught that cancer, I wouldn't be here now. I can't think of any other reason. No. And I've tried. It's mind blowing.
Yeah. I think you had to stay to inspire people and be an example for many.
Or make them go mad.
Well, either way, yes. It's
Whatever
about choosing. For me, that my biggest learning from you is choosing yourself, saying yes to yourself.
Yeah.
And that's for me, that's my biggest learning. So thank you for that.
Yeah. If people look at me and they go, well, if he can do it, so can I. My job's done. It's as simple as that. It really is that simple. That's all I want is people to know that they can do things. It might be tough. It might, you might go through hell, but you will come out the other side, and you will be a better person for it. That's what I want to show people.
God, this is bloody inspirational, man. This is bloody lovely. Oh my God. I want to thank you for sharing your story.
No, you know what? Thank you for having me on because I love doing things like this and I want to do more. I want to spread the positive message that you about.
You have a TikTok?
I do. It's called my TikTok is short_leg_cricket.
Brilliant. And you got a Facebook page?
Yeah, got Rob Legless.
And the book.
The book called From Disability to Ability, My Journey, and it is on Amazon on ebook.
All right.
And paperback, and I also got some bloke to read it as an audio book as well. Unfortunately, it's not me because I didn't think I'd sound great from doing a reading book personally. So
I think you undermined yourself. I think you'd be brilliant, but there we go.
They don't want to hear my dissect.
And again, massive shout out to Rach. Thank you for this. She'll be definitely listening to this because she's been asking me, have you spoke to him yet?
Legendary. Thank you so much, you two.
Really Thank you, Rob. Bye. Take care.
But of course, the story does not end there.
Join us in part 2, where we'll explore how amputations evolved during the First World War with medical historian Dr. Emily Mayhew.